Hi everyone, welcome back to another episode in the Nico the Vet series, and as always thank you to everybody who's taken the time to write in with your very positive comments, so thank you very much. Today's subject I thought we would tackle is an extremely broad subject, and I'll sort of narrow in and hone in on it as we go. I want to deal with the subject of itchy dogs. So if we start at the very beginning and say, if we look at how skin can react to problems, what can skin do if there's a skin problem? Skin can basically, it can go red, it can go itchy, it can go baldy, it can go rashy, or it can scab a little bit. And that's sort of as much as the repertoire of skin reaction is. However, the list of things that can cause those reactions is vast. It's a massive list. So you get these literally hundreds of problems or medical conditions causing often very much the same sort of symptoms and reactions in the skin. So we have to try to unpick this and unravel this and make sense of why your particular dog is affected by a particular condition. In very broad terms, I think if we look at skin problems, particularly itchy skin problems, there are going to be two main categories, not the only categories, but main categories. Firstly, there are parasites, and what do I mean by parasites? Well, there's the obvious, fleas, so fleas biting you will make you itch, and also the various types of mange, mites, and lice. So we'll put that under the umbrella term of parasites, and if you have an itchy dog, the first thing you want to do is make sure you don't have parasites. So look at the dog, particularly over the base of their tail. So run your hand, if their head's over this side, run your hand down their back, and where you get to the point where the tail goes off, that point there, part the fur, sort of pull your hand up against the fur, open that fur and look down there. If you see little brown things running around, those are fleas, and you've probably made your diagnosis. You've got your problem. Even if you don't see fleas, little brown things running around, look for what looks like little black grains of sand there. What that is it's not sand. It's called flea dirt, which is a euphemism for flea poo, because the fleas live on blood, so they bite you, they suck the blood, it passes through their digestive system, and then they just poo it out, and it comes out as a sort of clotted blood, similar to black pudding, which is a singularly disgusting thing, but it's also just blood, which is congealed. So if you see fleas, you've got your answer. If you don't see fleas and you see flea dirt, you've still got your answer. Mange mites can be slightly more difficult. They're generally going to cause a red, itchy, scratchy skin, some more than others. Some type of mange mites, the most common ones, for example, dermatitis, which is primarily a younger dog problem, will cause baldy patches without any itching. But you and your vet need to rule out parasites. To rule out mange, you've got to do blood tests and skin scrapes. Not all countries have the blood tests for what we call the fox mange or sarcoptic mange, and then you're down to skin scrapes or just a high index of suspicion. So let's assume we've determined that this dog does not have parasites. So we can't see any evidence of it. We've done all the skin scrapings, we've done hair plucks, we've done searches through the coat looking for the flea poo. Oh, here's a little tip too. If you find the flea poo, the little black grains of sand, and you're just not sure, is this flea poo, is this sand, is this scab, what is this? Take some off, put them on a white piece of paper, take a drop of blood, put that on the bit of flea dirt on the white bit of paper, then put your nail on it and scrape it like that. So you sort of scrape with your nail across the a little bit of flea poo, and when the water mixed into it, it'll smear red. If it smears red, you've got your answer. It's flea poo and you've got a flea problem. So again, let's assume we're happy that there are no flea or parasite problems there. What is the most next likely category? And the answer is allergies. Now this is a very broad term, and it's becoming increasingly the most common problem that we see. So what do I mean by allergies? Well, dogs like us are prone to having allergic reactions to things in their lives, and for some reason that nobody entirely understands, it's becoming increasingly common. When I was trained, allergies were not that common. Now they're increasingly common in dogs and in human beings, and we simply don't know why. So what do we mean allergy? So an allergy, the best way that I think about it is your immune system is constantly monitoring what's on and in your body and trying to determine what the threat level of that is. So if you look at human beings with allergies, for example, if a cat hair goes up my nose, I'm just going to sneeze once or twice, the hair will come out, and my immune system will go, okay, problem's gone, that's it, it's all done. If I was allergic to cats, then that same cat hair would go up my nose, I would sneeze, it would sneeze out, So the problem is gone, but my immune system would continue perceiving a threat. So it's falsely perceiving the threat, and it's a false threat because it's only a cat hair. So my immune system is making two mistakes. It's overreacting to something that it shouldn't be reacting to, and then once it starts reacting, it just keeps going and going and going and going. So I like the analogy of someone allergic to hairs again. So a cat hair goes up my nose. If I'm not allergic, sneeze it out. If I am allergic, even though I've sneezed it out, even though the problem's gone, I'm going to be sneezing for the next week or two because my immune system isn't cognizant of the fact that the problem is gone and it can settle down. So that's the principle of the allergy. Now in animals, we see just the same thing, and we'll focus on dogs today. So they are exposed to allergens. Now the allergen is just a name for the thing that sets you off. So what are the most common things that are going to set dogs off? What we call allergens in the air. So that's just stuff in the air. So certain times of year, it's predictable what that stuff's going to be. So spring and summer, you're going to look at sort of grasses and pollens. So that'll be tree pollens and grass pollens and flower pollens. And these just release into the air and you don't see them, but they're there and you're exposed to them. In autumn, where you see a lot of leaves coming off the trees and the leaves start composting as autumn draws to an end, you see a lot of toadstools and mushrooms, so you get fungal spores being released into the air. And then you often get a perfect storm in autumn time where you have the pollens that have accumulated over the whole of spring and summer, which have accumulated in the air, but the air's warm, so it carries the pollens up into the atmosphere. So you've got this warm air rising. Then winter comes, the pollens start coming down, and the fungal spores that drive composting of leaves and vegetation pushes spores up, and you get this perfect storm of a blend of pollens and fungal spore counts. And sometimes you'll even see this on the weather reports, where they'll report on the pollen count and the fungal spore count. So in my experience, there's my cat again every time. So you see often on the weather reports, you see the counts of how high these levels are. But summer is not the only time that you're going to see a problem. Winter, for many individuals, is even worse than summer and spring and autumn. Why is that? Well, it's house dust. Now, when I say house dust, I don't mean sort of the dust that you would wipe off a surface and have a look at. The concept of house dust is far more gross than that. Effectively, we are all shedding millions of skin cells every day, so they're just dropping off of us, and they have to go somewhere. If they didn't go somewhere, you'd be knee-deep in dead skin cells in your house, or even up to your waist after several years. So those dead skin cells have to go somewhere. And there are microscopic mites called house dust mites and storage mites, which live on and they eat those dead skin cells. And those are a good thing. You want the mites in there because they're microscopic, you don't see them, they're not a bother, and they eat your dead skin cells, so you don't have an accumulation of it in the house. The problem is, like anything that eats something, they poo something out. And that's what we become allergic to as human beings and animals. We become allergic not to the dust mite or the storage mite per se. We become allergic to their poo. I know it's a gross concept, but again, it's microscopic. So it's just tiny. It's not there. It's not a big deal that you're breathing this stuff in unless you're allergic. And I think there's 15 types of protein in the house dust mite poo. And in human research, they can even work out which one of those proteins in the poo we're allergic to. But it's enough to know that we can become allergic to house dust mites and storage mites. And the reason that that's most likely to bother us in winter is in winter when the weather is cooler, everyone's got the doors and the windows closed, the house isn't ventilating, the house isn't breathing, there's just stale air accumulating in the home. If you're not allergic, we call that a lovely cozy environment. If you are allergic, it's a nightmare because with this sort of cozy, warm, non-circulating air in your house, and there's no ventilation in the house, the dust mite numbers, particularly their poo, will start to accumulate and they become more saturated in the air. And so if you're allergic to them, that'll be a worse time of year for your allergies. So dogs are just the same as us. They become allergic to the same things. And so the old concept of having hay fever, as we call it, used to be associated with the hay making season, where people were threshing hay, throwing the hay and all the wheat chaff and so on into the air. You were creating a lot of muck and gubbins in the air, and the people were breathing it in and having an allergic reaction. And it was a very defined period of year associated with the haymaking season. That term has become largely nonsensical now. Because we're allergic to a variety of things, most of us will not have a defined allergy season. We won't be allergic in just spring or just autumn or just summer. And that's because it's very rare for us to be allergic to just one thing. So as things have changed over the last 30 years, people being allergic to hay in the haymaking season doesn't very uncommon. Some individuals are still quite predictable, and that's very lucky for them if they're allergic to just one or two things, because then we can tactically treat them that time of year. But for the vast majority of us, we're going to be reacting to something in every single season. So there's no longer a hay fever season. We're just reacting to different things at different seasons. And when we have our worst reactions, the times of year, we can predict what's most likely setting us off. So dogs are allergic to exactly that stuff in the air, so allergens in the air, which are variable during different times of the year. So the next thing that I find people struggle to get their heads around is in the human model, it makes sense. So let's say I'm allergic to grasses and pollens and house dust and fungal spores. I'm breathing them in, so they go up my nose and they go into my lungs. And in human beings, the way we manifest our allergies most commonly is we develop hay fever or asthma. And that makes sense because that's exactly where the pollen grains and so on are going into our bodies, and that seems logical. In dogs, however, we very rarely see the snotty nose and the asthma. We do see allergic rhinitis, call it sort of hay fever in your nose, a little bit in dogs, but generally not. In dogs, when they react to the same thing that would trigger hay fever or asthma in me, when they react to those same things in the air, they tend to manifest as itchy skin. And so they're generally itchy all over, but where we see the itching most pronounced tends to be the ears, so inside of the ear canal and on the ear flaps. So it's the ears and rears is the little rhyme, so ears and rears. So the bum area itches, and if you lift up the tail, you see there's often a bit of redness around the underside of the top of the tail. You lift the tail, there's a bit of redness there, and the bum's there, and that looks a little bit red. And if you look between the toes, so take their feet and open the toes like this, and look in the webs over here, and just get a sense of how red or how pink that is. If you're not sure, like what am I seeing here? Is that red or not? Just part the coat somewhere else, somewhere on their chest. Just part the fur and compare that to this color there. Obviously in the black dog, that's a moot point, but in dogs who are not black, typically sort of the average brown dog, if you open the coat here, you'll see the skin is virtually white, and then you look between the toes and you can see it's quite pink and blotchy. And turn the foot over and have a look at the underside too, in the webs. Also look at the armpits on both sides, and look on the underside of the tummy, and look in the groin. So although the dogs are itchy all over their bodies, the itching and the redness is most pronounced over the ears, rears, feet, armpits, and groin. Why is that? The way I like to think about it is, think of the lining of the ear canal as just being some skin rolled into a tube and shoved into your head. So you've got these two sort of tubes of skin going into your head. So if you took the lining of your ear out and you laid it flat, you've got quite a big area of skin which is just rolled up into a relatively small space. And your feet are the same. If you were to peel all the skin off my hand and lay it flat and stitch it together, you get quite a big area of skin. So wherever you've got a lot of skin condensed into a small amount of space, either because it's rolled up in your ear or it's spread over all your fingers, you will amplify the problem because there's a lot of skin in a small space, so it just exaggerates the problem in that space. So although you're looking at those classical sites, you'll often not see the textbook case every time. So the textbook case are ears, rears, and feet, but you're not going to see those. Some dogs it'll be just the ears, or perhaps just one ear, and the next dog it'll be just the feet, or even just one foot, or the left front and the right hind, or just the bum, or the bum and a foot. You get the idea. Sort of any permutation on that theme is what you're going to see. The reason why, I mean, why are they manifesting like this rather than hay fever and asthma like we do? And there's many theories, but probably the most accepted theory is your skin makes oil and grease. That's why our skin feels supple and soft like it does. If you have dry skin, you'll see it as dry and scaly. But most of us, the reason our skin is the way it is because we're producing oils in the skin. and that's normal. But when the oil is made, imagine it in great big slabs like crazy paving. And what you should do is you should get great big, if this is the surface of the skin, I'm going to find it like that, you should have a big slab of crazy paving, of sort of microscopic grease on the skin, and then another slab with a big overlap, and then another slab. So you've got this huge crazy paving idea, but with big overlaps between the slabs. And that protects your skin, because all the stuff landing on your skin, so the pollens and the grasses that I'm breathing in that give me hay fever and asthma, those pollen grasses are settling on the dogs, and the crazy paving slabs of grease, if you like, or wax, protect the skin from these allergens. In allergic dogs, imagine someone would take like a whisk to it, and you're whisking up meringue or a cake mix, and you sort of whisk up the wax and the grease on the skin, and you lose this big sort of overlapping effect of all the slabs on the skin, and you end up with this sort of whisk effect with peaks and troughs, and that allows the stuff in the air, the allergens, to settle on the skin and sort of trickle down past that what should have been the protective layer and settle directly on the skin. And that's then it sort of once it's up against the skin, that's how it triggers the reaction. They also did an interesting test once to investigate the ear reaction that we see most commonly in dogs, to say, well, does it mean that these allergens are settling in the ears? Is that the exposure route, in the same way that I breathe it into my nose and get hay fever? So they took a bunch of dogs and they allergy tested them, and they knew exactly what they were allergic to. So each one had their own list of pollens and grasses and house dust and so on. And they put them then in a filtered air, environmentally controlled environment for, I think it was 2 or 3 months. I can't remember exactly, but the principle was they would have been in this filtered air environment, so they could not possibly have been exposed to it. And they made them all little Batman suits, so they all had these little hats on covering their ears, so nothing could go into the ears for, again, 2 or 3 months. And then after 2 or 3 months of being confident that there's no way they've been exposed to this stuff and they've been wearing their little Batman hats, they then, for each individual, they mixed the grasses or the pollens in that we know set them off. They mixed it into their food and they ate it. And bang, presto, all of them got their red inflamed ears back. So what it demonstrated was that it's not necessarily that the allergens in the air are settling into the ears causing the reaction. It's just any exposure of the body to the problem is going to manifest as inflammation in the ears, if that's the way you manifest. So that's an important take-home point, is the route that your allergen goes into you doesn't necessarily have any bearing on where you have the allergy. So think about people with a peanut allergy. So if you eat 1 or 2 peanuts, even if you realize then, oh my word, I've just eaten a peanut, I shouldn't have, and you spit it out, you're too late. The immune system is going to react inappropriately. This is the definition of an allergy. It's now freaking out about the peanut, which it shouldn't be. Secondly, even though you've gobbed the peanut out and it's now gone, the immune system malfunction or overreaction or inappropriate reaction will continue. And thirdly, it's not just going to affect your mouth, which is where you were exposed to the allergen. It can kill you because it causes effects in your heart and your lungs and your circulatory system. So just the mechanism or the process whereby the allergen gets into you or onto you has no bearing necessarily on where the allergy manifests. And that's why I find a lot of people struggle to say, well, hang on, I understand hay fever and asthma, but why the itchy ears, rears, and feet? The answer is just that's how dogs do it. If you told dogs that allergies give you hay fever and asthma, they'd say, well, that's weird, man. No, it doesn't. You know, in our context, it gives you itchy ears, rears, and feet. So just get your head around that, and once we've got our head around it, we know. Now, you can often diagnose an allergic dog from 100 yards away. So typically light-coated dogs, like white and very fair coloured coats. If you walk down the street and you see a dog with sort of a brick red orangey colour on their paws, sort of perhaps not really this colour, a little bit more orange than this coaster, and their feet are that colour, and often you'll see a little bit around their ears and often around their bums, this sort of brick red sort of staining. You know, you can diagnose that dog. That dog is allergic. How do we know that? Saliva is what stains the fur that brick red color. So the only way you could have got enough saliva onto the coat to stain it that sort of color is if the dog is spending a lot of time licking. And often people say to me, well, my dog doesn't lick. I'll see the red-orange staining on the, reddy brown, I should say, staining on the paws, and I'll say, well, your dog is allergic. And they go, oh, he never licks his paws. I haven't seen him licking his paws. That dog's licking, because the only way that those paws have been stained that color is by licking. So he's maybe not doing it in your presence, but when you're asleep at night, that's when he's licking his paws. And licking is sort of the dog version of scratching. So I'll sometimes use the terms interchangeably. So for example, if my hand was itchy, I would sort of just be sort of scratching my hand and alleviating the itch. Dogs can't do that, of course, so they lick. So lick, scratch, it's the same thing in dogs. No, flea, go away. So, go away. Go away, go. So, so when you see, blooming cat every time. So when you see this brick red staining around the paws, you often see it in the armpits if they're licking the armpits, and the underside of the tail. Take the time to look in the ears too. If your dog has a history of recurring ear infections, it's because of the allergy, and I've dealt with that under a separate talk. So just look at the main channel page and you'll find that talk there. It's much the same as this, but that one was focusing particularly on ears. So recurrent ear problems, recurrent foot licking. A lot of people think the dogs are just cleaning themselves. I think he's very meticulous when he comes in from outside, so he's cleaning his feet. No, he's not. He's allergic. And a lot of people say, well, he's just chewing his nails. It's a habit. No, it's not. He's licking it because he's allergic. And other people think, yes, he must be reacting to the grass that he's walking on, or something in my garden, or something on his walks, and that's why he's licking his feet. Again, no, it's not. You can get contact allergies, which is different to allergies in the air, atopy. But 99.9% of the time, it's not going to be a contact allergy. It's going to be atopy, and it just happens to manifest in the feet for all the reasons we've discussed. So if you see brick red staining on your feet, you know your dog's allergic. If you see recurrent inflammation in the ears, you know your dog's allergic. If your dog's bothering their bum a lot, almost certainly they're allergic. If it's not allergy, it's going to be problems with the anal glands, or worms. So if you worm your dog fairly regularly, and if you squeeze out the anal glands and the contents look normal, then you can conclude by process of elimination that the reason the dog has got an itchy bum is that they have allergies. So how do they manifest? How do you notice that your dog's got an itchy bum? Either they're sort of trying to get around and lick the bum. So again, licking is the analog of you and me scratching. So they're either licking their bum, and if they can't reach, or it's uncomfortable for them to reach, they do that thing where they put their back legs out forwards, they put their bums on the ground, and they sort of pull themselves along, dragging their bum on the ground. Vets in the veterinary world, we refer to that as scooting, and the reason they're scooting is the bum is itchy, so they're dragging the bum along the ground. I had one chap once come to me and I said, right, what can we do for you today? And he said, my dog's doing yoga, that's the problem. And I was like, what do you mean your dog's doing yoga? So after much discussion of him describing and me trying to understand, that's what he was trying to describe. So it's that back leg sticking out, bum on the ground, pulling yourself along with your front legs to scrape your bum along the ground. So if you're seeing those signs, you can pretty much conclude that your dog is allergic. Now, the obvious thing to do is look at them first and just make sure that there are no parasites, like we said at the beginning of this talk. And once we're satisfied that there aren't any parasites, then we would conclude, yes, almost certainly you're allergic. Having said that, you should also look at the distribution of where you're most itchy. So like I said, the atopy, which is an allergic reaction to stuff in the air, that typically manifests as, I know I keep banging on about it, ears, rears, feet, armpits, and groins, with sort of a generalized background of itching. If most of your itching is centered on the base of the tail, so over the lower back where the tail sort of goes out from there, that bit of the lower back, part the coat, look there. Even if you see fleas or you see flea dirt, and even if you see none of that, and you see the reaction and the itching is limited to just that, the top of the base of the tail, not the underside, that's the atopy, the top of the base of the tail, then it's going to be a flea allergy. Now, a flea allergy is not the same as a flea problem. A flea problem means you've got too many fleas on you. A flea allergy means you are allergic to one or two fleas. So again, the peanut analogy, it doesn't take a whole bowl of peanuts to set you off if you're allergic. So if you're allergic to fleas, where the average dog could have 20 or 30 fleas and not be that bothered by it, if you're allergic to fleas and they bite you, even if you immediately spin around and they sort of nibble their coat and kill that flea and get rid of it, too late. It's triggered the reaction, and you're going to have the itching and the inflammation and the scabbing and the scratching that goes with it. So if the itching is limited just to the lower back at the top of the base of the tail, yes, you have an allergy, so you do need to address the allergic reaction, but you're in luck because it's been triggered by fleas. That's if it's exclusively in that area. And the reason I say you're in luck is if you just exercise meticulous flea control on all the animals in the house, not just your affected dog, Because remember, you could have a dog or 2 dogs and 2 cats. One dog's allergic. That means one flea getting hold of that dog will set him off, whereas the other dog and 2 cats could have 20 or 30 fleas and not be bothered. So why treat all of them? Well, they're acting as the source of the new flea biting the allergic one. So you have to treat everybody to get it under control. And like I say, that if you have to have allergies, that's a blessing. If you have just a flea allergy and you're not really allergic to anything else or not significantly allergic, because if you A, treat the allergy in the short term, and then B, blast the fleas, well, you've just controlled your problem. So that is terrific. Also, if you're itching and you inflame, and it's predominantly sort of the ears, not the inside of the ears, actually the ear flap, and possibly even elbows, if those are your main sites, then you may well have sarcoptic mange or fox mange or scabies. You may well have that, not an allergy. It can be sometimes difficult to differentiate between the two just looking at a dog. So again, you may have to do some skin scrapes or some blood tests to rule out that it's not fox mange, and then you're left with allergy. If you had to choose between the two, you would much rather it was a parasite, because you can eradicate the parasite. Whereas the allergy, you cannot eradicate an allergy. If you're an allergy sufferer, we can massively change your life. We can manage your allergy, we can control your allergy, but we can't cure you. So again, think about the human model. If someone's got hay fever or asthma or eczema, we can treat them, we can help them, but we can't fix you. We can't give you something and then you're cured forever. So that brings us down to, so how do we manage these dogs? So once we've decided, yes, you are an allergic individual, what can we do for you? Something that we used to use a lot years ago, and some people are still exponents of it, I'm not, is the concept of desensitization. So we can do some tests on you and work out what you individually, what are you allergic to? So the old system used to be that sort of draw a grid on the side of you and do those little pricks with various things and see how your body reacts to the pricks of the various potential allergens, and then we know what you're allergic to. You can also do it on a blood test. Who knows which is the best? Nobody knows. The debate rages on. But what you get out of it is I get what you as an individual are allergic to. And then the theory is, if I take that compound and I get a lab to make it up into an injectable form, so let's say I'm allergic to oak pollen, tree pollen, 2 or 3 grass pollens, and 1 or 2 types of house dust mites, they'll make those components up into something injectable, and then we inject it into you or your dog in ever increasing amounts over the long term. And the idea is that we're trying to get your immune system used to the problem. So that's called desensitization. So it's an elegant idea, because you think, well, if I can inject myself with it and my body will get used to it over the long term, then I'll stop reacting to these things, and that will be my allergy treatment done. So I've tried it for years, and I've just had very, very disappointing results with it. And I went to an interesting talk once where a vet put up his hand and asked the skin specialist a good question. He said, well, hang on, why are you saying if we inject these allergens into ourselves, we will build up a tolerance for them, but not if we're exposed to them naturally by breathing them in and they settle on our skin and so on? And the dermatologist said, well, that's exactly why I'm not a fan of it. But as it happens, he was standing in for a friend of his who was a fan of the desensitization treatment. So I'm not saying it's absolute rubbish. I'm just saying in my experience, I've just had no joy with it. So I don't like it as a way of treating. I wish it would work better, because that's the most elegant solution, because it effectively cures you, in inverted commas, if you build up this tolerance. But in reality, we're down to giving you medications. We're going to have to, just like someone with hay fever or asthma, they're going to use their inhalers and their tablets and their nasal sprays and so on. Dogs are just the same. We're going to end up having to medicate them. And we have various options. First of all, we have the option of treating you topically or systemically. So what we mean by topically is, if I had hay fever and I put a nasal spray up my nose, I'm putting a bit of steroid straight up my nose, that's topical treatment. So it's going just a little dose going just where I want it and not really affecting the rest of my body. So that's a topical treatment. A systemic treatment is if I take a tablet. So I take the tablet for the hay fever in my nose. How does the tablet ingredient know to go to my nose? It doesn't. It just treats allergy anywhere in my body, but because it's really only manifesting in my nose, it'll hopefully alleviate my symptoms. So in the veterinary world, we have the same. We have topical treatments, and we can try things like washing. So again, if we say the allergens are settling on your skin and they're leaking through the disrupted, they call them lipid lamellae, or these crazy paving slabs. If yours are disrupted, you're just making rubbish slabs, then washing you, just the physical act of washing you rinses off the allergens and gets rid of the amount of stuff trying to set off your skin. You can use oatmeal shampoos and various other soothing shampoos. I find just rinsing with water, if you understand the concept concept is if you're trying to get the topical allergen off you, just rinsing with water seems to my mind to be as beneficial. A bit like when you've got sunburn and you go for a cool shower, just that rinsing, cooling effect will ease the inflammation in your skin. However, it's a short-term respite. It doesn't cure you. So apart from just washing and cleaning, again, you be careful of stringent shampoos, because all you're going to do is strip away what lipid lamellae, what even the poor quality of grease and wax that you have on your skin. You're going to strip that away, and that's even makes you even more vulnerable. So we don't want to use a stringent shampoo. So you can't use human shampoos, not even baby shampoo. You need to use specialist veterinary allergen relieving shampoos, and like I say, the oatmeals are probably oatmeal based ones are the most popular. So topical treatments, there are some steroid sprays available. They literally like a lady's hairspray, a little pump action spray, and you can spray that sort of between the toes, onto the bum, in the armpits and the groins. Topically, you're putting it exactly where you want, like a hay fever nasal spray, and that works well for about 50% of dogs. Don't put it in the ears. You can put it on the actual sticky outy bit of the ear, but don't put it in the ear. Cortevance is the product that I've used for this purpose. Again, it's not a plug. I don't plug anyone. I have no allegiance to any drug company. I just have developed a sense of what works and what doesn't. So topical treatment, if it works, is great, because your body's total exposure to medication is minimized. But for most individuals, you're looking at taking systemic treatment, some kind of tablet, and there's various categories to choose from. So let's start with human antihistamines. Human antihistamines work beautifully in most human beings. In dogs, they're just rubbish. We've tried them all. They do very little in terms of controlling the allergy. Some of them will have a sedative effect, so you make your dog a little bit stoned and woozy. And so yes, he might itch and scratch less because he's a little bit woozy, but it's not because you've addressed the problem. You've just made your dog stoned. So that's not a great solution, having a dog so stoned that they can't itch, because the itch is still there. They're just too stoned to do anything about it. So human antihistamines, waste of time. Don't go there. The next category of drug are steroids, your typically prednisolone. These are corticosteroids or cortisones. They are fabulous. They're cheap as chips. They work very reliably. They're predictably good, and they work very, very quickly in controlling allergy. The downside is they have side effects. They're not catastrophic side effects. They make you hungry, they make you thirsty, and if you're drinking more, you're going to pee more in the short term. But that's fine if you're doing just a short course of treatment. But over the long term, they have more significant side effects. You start to lose muscle bulk, you start to gain a bit of body fat, your liver swells, your skin thins, and you become more prone to secondary infections. So as a long-term solution, they're just not great. But as a short little blast, particularly if you're the dog who has 1 or 2 flare-ups a year, I think that's perfectly appropriate. But if you're the dog who's itchy most of the year round, you don't want to trade your itching for all the steroid side effects. So the next category of drug along is a medication called Apoquel, which is a beautiful drug in terms of its elegance. It targets so although you're taking the tablet and it's going throughout your body, just like the steroid goes throughout your body. So if you, for example, had and a skin allergy, and you also had asthma, and you also had irritable bowel syndrome, then taking the steroid is a great option, because it will not only treat your itchy skin, but like I said, it distributes throughout your body, and it treats allergic inflammation at any site. So if you had hay fever, asthma, eczema, irritable bowel, and itchy ears and rears, then that's great. It'll blast all of those. So the Apoquel, moving on from the steroid, is basically, think of it as it does what the steroids do in terms of controlling the allergy, but it's different in the sense that it only targets allergic inflammation in the skin. Secondly, it doesn't have the side effects of the steroid. So that seems to me a no-brainer. So if you have the itchy dog, no other systemic allergies, just the itchy ears, rears, feet, armpits and groins, and you don't want the side effects of the long-term steroid management because your dog is reacting in every season, then reach for a drug like Apoquel. Like all drugs, it's not 100% effective. I would say it works for 95, 98% of dogs. And I like the elegance of it, that it's not treating the whole body. It's just treating the allergic inflammatory cells in the skin which are associated with the itching. So why are we not using that every time? Pros and cons. It's great, doesn't have all the side effects of the steroid. Con is it's much more expensive than the steroid. But if we look past the costs, it's a much better solution. If you're the 2 to 5%ers who don't respond, there are two alternative drugs. One is a monthly injection called Cytopoint, and the other one is a monthly tablet containing a drug called cyclosporin. Now, the medical colleagues of mine in the human arena of medicine freak out a little bit when I mention cyclosporin, because in human beings, it's a big hitting drug. It's the sort of thing they would give you if you were having an organ transplant and they had to have massive sort of modulation of your immune system. So they get very twitchy when I talk about cyclosporin for their dogs or their cats. But in the veterinary world, it doesn't seem to be quite as big a deal a drug in terms of its effect on the body as it is in human beings. So just species difference. Human beings, you might want to be a bit cautious. Dogs and cats, it's grand. Get it, you can use it. Again, pros and cons. It does what we want it to do. It works efficiently. It's a great long-term solution with little to no side effect. Downside again, it's expensive. But if we can manage it, then that's absolutely what we would how we'd want to treat these guys. And often just treating the allergy is going to be the concept long term. You want to put this dog on, if they're affected by the allergies all year round, put them on it for life. You're on the medication for life. People are often a bit resistant to that idea. And I say to them, well, think about this. When your dog's got the skin allergy going on, consider the worst sunburn you've ever had over your entire body. That uncomfortable, prickly, stingy, can't sleep, you're agitated, you're annoyed, you can't get any respite from it. Consider that feeling and times that by 10 and feel like that all the time. That's what these allergic dogs are feeling like. So I think it's a moral imperative. We should be treating these dogs. And when I do treat them and the people come back, within a week or two, the drug usually will have 90% resolved the problem. It's amazing what the people say to me. When I say to them, how are we getting on? They very rarely will just say, yeah, the itch is much better. They'll come back and say, oh, the itch is much better, or it's gone. And they say, but my word, the dog is so much happier. He's sleeping better. He's more rested. He's more cheerful. He's more interactive. He's playing with the other dog. He's just quality of life is just massively improved. And again, to understand that, take the worst sunburn you ever had, times it by 10, and live with that all the time. It's just dreadful. So I will get on my knees and just beg people, please, 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 please. Even I see some people cynically look at me like, oh, you're just trying to sell me something. And I'll say to them, look, just humor me. Take a 2-week supply of these anti-allergy medications, try it, and then you come and tell me whether you want to carry on with it, yes or no. I'm not going to do a high-pressure sell here. I'm just going to point you in the right direction. I'm going to give you the appropriate advice, and I'm going to let you see the response, and then please, let's help this dog. And inevitably, they come back and go, oh my word, I had no idea the dog was this distressed by their skin thing. I thought this was just, the way they were. They've been like this their whole lives. And I've seen several vets, because I've had several ear infections and several skin infections over the years, but no one's ever taken this holistic sort of, let's just get the big picture sorted out. And they just converted. They say, well, I'll sell the car, I'll sell the husband, I'll sell whatever, just so that I can afford this medication and get it going. And there's an important point. Although this is your long-term management for these guys, in the short term, often when I see these allergic dogs, because they've been itching and scratching and rubbing, they've obviously often broken the skin's disrupted, and they'll often have a secondary infection. What I mean by that is our skin are all covered, all of us, if you swabbed my skin today, we're all covered in yeasts and in bacteria, grim thought, but again, just like the dust mites, it's all microscopic, it's all good, it should all be there, it's appropriate. When you're allergic, it often disrupts your immune system's ability to defend the body against these normal bugs, and that gives them the edge, really, gives them the advantage. And a lot of these allergic dogs will present with a skin infection on top of the allergy. So the allergy invited the skin infection, and it's managed to get hold of them purely because they are allergic and their skin surface is disrupted. So if you took the bug that's causing their infection in the allergic dog, if you took that off and put it on another dog, nothing would happen because that dog's immune system isn't disrupted. So a secondary infection means some disruption had to happen for you to get the infection. Then the cruel reality of it is the The allergy invites the infection. You get the infection, so you're colonized with yeasts and bacteria, and then you have an allergic reaction to the parasites, and then you have more disruption, so you get more parasites. When I say parasites, I mean yeasts and bacteria, and you get in this vicious circle of allergy invites infection. Infection promotes more allergy, and then more allergy gets more infection. Round you go. So you have to determine, do you have a bacterial or yeast infection on top of the allergy, because it's not enough to just treat the allergy. So you treat the allergy, determine whether you've got a bacteria or a yeast on the skin at the same time, and then go on a course of antibiotics to eliminate that. That's not a forever thing. That's just to kill the secondary invaders, and it takes anywhere between 2 and 12 weeks on average, a course of antibiotics or some sort of anti-yeast treatment. You often have a strong inkling that there's something like that going on, because when you feel these allergic dogs, if you run your hand along their coat, they feel greasy. It's almost like the lanolin sort of grease effect that you'd expect to feel on a sheep. So if your dog feels really, really greasy, it's a very strong indicator that they have a skin allergy, and very likely on top of that a bacterial or a yeast infection. Very easy to determine which it is, and treat appropriately. Sometimes the skin infection will also present as sort of scabby, jaggedy rings, and people sometimes confuse that for ringworm, which is badly named because it's not a worm at all, it's a fungal infection. But you see these sort of scabby rings. I always think of them as like a volcano. So the allergic reaction in your skin causes like a little blister to form. The blister then sort of pops open, and you get this initially sort of scabbing effect, and then this infection sort of comes down, like coming down around sort of Mount Vesuvius, and it comes out and it spreads out, and it forms this jaggedy ring of infection, which gets bigger and bigger and bigger and bigger and bigger. Sometimes you can even get what they describe as bullseye lesions, where the center of this sort of baldy bit goes a bit sort of bluey black. And people again will think it's a fungal infection, and it's not. It's a bacterial infection. They're called epidermal collarettes, and they can get bigger and bigger and bigger and bigger and just spread out. Look for them typically sort of part the coat sort of here, look for them here, and look at the underside of the inside of the thighs, the groin, and the armpits, and you'll often see these what I call coalescing rings that are coming out. Over the long term with the skin infection, or the skin allergy I should say, you get this sort of reactive thickening of the skin called hyperkeratosis or lichenification, which basically means you just get this thickened, bobbly skin. It looks like a bit like army boot leather, that sort of bobbly leather effect. And that tells you again, this dog has had an inflammatory disorder going on in the skin for a very, very long time. And so it's going to take some time to undo it. So I hope that makes some sort of sense to everyone. For me, it's a big deal. It's an increasingly common thing in human beings and in animals that we see these allergies. They've done a huge amount of studies into trying to find out why they're becoming increasingly common, and nobody really knows. It's happened in the space of literally one generation, so it can't be us, it can't be our genetics. It has to be something environmental or regarding our lifestyles, and we just haven't figured it out yet. One small thing that people will often say to me with the skin allergies is, my vet told me it's probably a food allergy. It's almost never a food allergy. And just to be a little bit pedantic, there's a difference between a food allergy and a food intolerance. So a food allergy means I should be able to, if you're allergic to a particular food, I should be able to give you that food, bang, your skin reacts. I stop giving you that food, your skin settles down. I give you that food again, bang, your skin reacts. So I should be able to switch it on and off with the food if the food is the trigger. And that's rarely the case. But what is quite common is that you could have a food intolerance. And what I mean, the difference by that is, if you consider me, for example, with hay fever, let's say I'm living in summer, and for the last several weeks and for the next several weeks, the pollen count will be about 10 grains of pollen going up into my nose every day. I will have what's called an allergic threshold, which means it takes a certain amount of the allergen, in this case the pollen, to go into my nose to trigger the allergy. So let's say my allergic threshold is 10, and let's say 10 grains of pollen. So if I go outside today and the pollen count is only 9, for argument's sake, I'll breathe in 9 grains of pollen, but I won't actually show an allergic reaction because you've not breached my allergic threshold. You've not given me enough to trigger me. But then tonight I'll go home and I eat, for me it's pizza or any dairy product. I'll go and eat a pizza, and tomorrow the pollen count is still 9, but tomorrow I have hay fever and asthma. And so my obvious conclusion would be, oh, I must be intolerant to pizza. It must be the cheese on the pizza. It doesn't agree with me. I mustn't eat pizza. That's not the case. What has happened is the pizza or the dairy product that I'm intolerant to, not allergic to, has reset my allergic threshold. So although the pollen count is consistently sort of 9 grains of pollen in the air, and my allergic threshold yesterday was 10, so it wasn't enough to trigger me. Now that I've had the pizza, it's dropped my allergic threshold to 5. So now 5 or more grains of pollen will set off my allergy. And now that I've eaten the pizza and I go outside and the pollen count is still 9, which it was yesterday, I now react to it. So again, I'm not reacting to the food, I'm not reacting to the pizza, but the food has affected my allergic threshold, so I'm going to kick off where I wouldn't have kicked off if I hadn't had the food. I hope that makes sense. So that means manipulating diet does have a role, because if we can manipulate your diet, we can affect your allergic threshold. And if we can push your allergic threshold up and up and up and up, then you can tolerate more grasses and pollens and house dust and storage mites than you did normally. So we'll often do food trials, and you have to be extremely pedantic about this. With allergies, you have to feed what we call a novel protein diet. And just to rewind a little bit on that, human beings, if we have food intolerances or food allergies, but mostly it's food intolerances. With us, it tends to be wheat and dairy, so gluten and dairy intolerances. So that's what we would try to avoid if we had allergies. And a lot of dog food manufacturers will produce this food where they go, it's wheat and dairy free, therefore it's hypoallergenic. It just drives me insane. I think they're appealing to the fact that that is a familiar model to us, and we go, oh yes, my Auntie Mabel and my Uncle Fred have, one has a gluten and one has a lactose intolerance, so yes, that makes sense to me. That's the food I'm going to buy for my dog. In dogs, it's almost never a lactose or a wheat intolerance. Almost never. With dogs, if they have an intolerance, it's almost certainly down to the protein in their diet. And to split hairs a little bit, if you have a wheat intolerance, it's usually a gluten intolerance. And what is gluten? Gluten comes from the gliad portion of wheat, which is basically a protein. So it makes sense, and if you look at the dog model, it's not going to be wheat and dairy. In dogs, it's usually the protein they've eaten. And the biggest culprits are beef, mutton, lamb, and more I find chicken. So if you want to manipulate the diet to see if you can help your dog's allergy, again, not because they're allergic to the food, but because the food can affect the allergic threshold, then we want to look at novel proteins. So we look at proteins that the dog has never eaten before, because you can't be allergic to something the first time you're exposed to it. Think about people who are allergic to bee stings. It's not the first bee sting that will kill you. It's once you've had 2 or 3 bee stings that your immune system starts anticipating this, and then you have that next bee sting, which gives you this massive immune system overreaction and anaphylaxis, and that's it. So when we're trying to feed you a different food to moderate your allergic threshold, we need to look at novel protein food. So avoid beef, mutton, lamb, and chicken. So what does that leave? It leaves venison and fish. And if you want to go the whole hog, the foods that I would most like to feed dogs to see how much I can affect the allergic threshold would be the novel protein foods. And the 2 I like most for this purpose, again, not a plug for the manufacturers, but Royal Canin make one called the Allergenic diet, and Hills make one called the ZD diet. If you want to do sort of a home cooking, then again, just go with novel proteins. So you could try something like fish or rabbit or venison, depending on where you live in the world. Again, that will, how much of a contribution does that make to the overall management of your dog's problem? Probably, if you say 100% of the effect you're trying to get, you probably get 95 to 98% of that with the medications. And typically, like I say, I like Apoquel and Cytopoint and cyclosporin for these guys. And the little bit of improvement you can get, a little bit of adjustment you can get, would further benefit would be from experimenting with the food. Sometimes the food, not that dramatic effect, but you may then find you get away with lower doses of the drugs. Because once you've committed to these drugs, the endeavor is to wean down to the lowest minimum effective dose. So what that is you get the allergy controlled, and you taper down until you've almost just trickling in the minimum amount to control the dog's allergy, accepting that once you're on that trickle amount, you will come into certain times of the year, often often autumn in the UK, where you'll just get such a strong allergy challenge that you'll flare anyway, and we may have to pulse the dose and just track the severity of your allergy, but then we'll trickle back down and maintain you. So the long and the short of it is, let's all get together, let's all get on the same page, and let's help these dogs as much as we possibly can. Thank you. Hopefully I'll see you soon next time. Bye bye.